views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, March 23rd. Coming up, we'll discuss the Bronx-wide platform and how you can join 24 organizations committed to building #Bronx Power through racial justice and economic democracy. Then, March is Colorectal Cancer Awareness Month. Stay tuned to learn more about early detection, prevention, and more with the Whole Health Report presented by Empire BlueCross, BlueShield. After that, we'll find out how Scholas is offering free technological support to local small businesses through their new Tech Help Desk initiative. And we'll take a peek at BronxArtSpace's new exhibition, Giving Light, an art antidote to gun violence, and the Soulbox project later on. So please, stay tuned. Open BXRx starts now. Welcome to Open BXRX on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Over the course of a year, thousands of Bronxites have engaged in a participatory process to develop the Bronx People's Platform, seeking to create a collective vision for the Bronx that would unite organizing efforts across the entire borough. Joining us now to share more about the Bronx-wide platform are Katherine Mella of the Bronx Cooperative Development Initiative and Roberta Todd of the Northwest Bronx Community and Clergy Coalition. Welcome, ladies. Thank you so much for joining us this morning.
Thank you.
So first to start, can you tell us about the Bronx-wide platform and when and why it was created?
Yeah, so as you said, the Bronx People's Platform for NYC was just released in January of this year. And it's actually building on a few years worth of work. So back in the fall of 2019, the Northwest Bronx Community and Clergy Coalition and the Point CDC decided to anchor a Bronx-wide process, bringing in my organization, BCDI, and organizations from across the Bronx to really think about what it would look like to build a Bronx-wide vision and platform. And at the time, it was really grounded in the upcoming congressional elections. So folks were going to vote for who would be the next Congress member representing the Bronx. And it felt like a really important moment to really think about what it would look like to come up with a shared vision and a community-led platform for systemic federal level priorities. So that was released in the spring and summer of 2020. And then given just all of the elections happening this year in New York City, so we're picking new city council members in the Bronx, we're going to pick a new Bronx borough president, we're also going to elect a new mayor. It felt really important to translate that platform into a local level set of priorities. And so similarly, we went through a community engagement process in the fall and winter of last year, bringing in community members and other organizations to create the Bronx People's Platform for NYC.
Thank you for sharing, Katherine. And as we know, the Bronx-wide platform has a list of demands and values, but folks in the Bronx may not be familiar with them yet. So can you just share what those are?
Yeah, so the platform represents 8 different systems. So, including energy, housing and land use, criminal justice, education, immigration, the electoral system, and maybe a few others that I missed there, but really representing, a lot of the different pieces that, impact our lives. And across each of those systems, we came up with a set of policy priorities, mostly really grounded in our shared vision for advancing racial justice and economic democracy, which for us really is about ensuring that Bronx residents are owning and controlling and making decisions around things that happen in our communities. And also a set of values and principles that Roberta can share. And so for each of those systems, we have, a set of priorities. I'll share an example now, just to give you a sense. So for housing, we name really specifically that we need to ensure that, all Bronxites and New Yorkers have access to, affordable, like truly affordable and permanent, safe housing, and have listed ways that we think we can move that forward, including making sure that we consider housing as a human right. We talk about implementing development without displacement. So really ensuring, again, that when we talk about development in our neighborhoods, that it's equitable, that it's benefiting the folks who live in the communities currently, and that we also advance community and tenant ownership. So for us, a really critical piece of this is how we own the assets in our communities, like housing, like land. And so that's just a sense of what's happening in one system. And again, we identify different priorities across the other 7 collectively to ensure that they're reflective of our values and principles. So maybe Roberta, you can talk through the values and principles piece.
Sure. When you think about our values and principles, and think about what Katherine was describing, what we do try to do is if we address everything from a systemic level, that means we focus on the root causes and inequalities that are working to transform the system. So if you think about how she's talking about having fair housing ownership, that fits into that. We talk about racial justice and putting people of color at the center of this work. And we must consider that in the fact that we are in the Bronx, and we know that the Bronx consists majority of people of color. And when we say that we apply an intergenerational lens to ensure all voices are reflected, I'm an example, I'm retired. We also have high school students that are sisters and brothers, and we have youth ministries for peace and injustice, and they also work alongside us when we discuss these issues. And we also apply a gender justice lens. That is to make sure that we center women and gender non-conforming people that often are left at the margins. And this is all of these issues are very important. And we look at the environmental sustainability lens. And when we say that, we are considering it from the perspective of Bronxites, that from the perspective of pollution, for the need for more green, because we know that we need to take care of our planet and that impacts our community's health. And these solutions need to be evaluated from that perspective. So that means if we're talking about people coming in and building housing, we're going to look at it from that perspective. And then finally, we talk about economic democracy, and that's a framework for addressing the fact that and we know the Bronx suffers from poverty and inequality. So we believe that it's important that we're sharing power, and we're creating shared ownership and wealth in the Bronx for all Bronxites. So those summarize our values.
Thank you, Katherine and Roberta, for sharing those platform demands and values. Why was it important to include the entire Bronx community in this platform as opposed to just certain catchment areas in the Bronx?
Well, it's 2 things. The Bronx is very wide, and it's a very, and people and power make a big difference in a coalition. So when we're talking about the Bronx, we want to make sure that everyone knows we're talking and trying to make it better for everyone here. So that's why we have a coalition of people from various areas, various interests, but we all can get together when we know that the most important focus is fighting to make Bronx and Bronxites equal and to have the rights that they should have, because as we've been watching the economy, and I'm sorry to say, but when you consider what happened with COVID, we know that this is impacting all of us in the Bronx. What's very important also is that we find that we have little groups and we're fighting one little war here or another little war there. That's a fight back. But if we get together, we can get together and we can fight together with shared visions and strategies, and we can see that we're fighting forward And together we can guide each other in terms of that movement. So that's why it's important that we work together so we can see the whole picture and make it better for the entire Bronx.
Absolutely. And in preparation for today's actual special election day, today is March 23rd, BWP has held a series of candidate forums. Can you tell us a little bit more about these events and how people can tune in and stay in touch?
Well, when we've had 2 candidate forums because there are special elections for a District 11 and 15. And in those forums, when we hosted those forums, we had community people speak and ask questions. And most of the questions are along the basis of our platform. And we gave every candidate an opportunity to give an answer so that our community members can make good decisions. We have recorded all of these forums, and they can be found on the Northwest Bronx Facebook page. So Facebook Live, so that's at Northwest Bronx Facebook Live or at Bronx Future. And these are very good starting points if you are still undecided today and you're going out to vote. If you just aren't sure, we ask you to go there because you can rank how you want to vote based on the answers to some of the questions that reflect what community members in the Bronx have to ask.
Absolutely. And what I've also noticed is that a lot of organizations are part of the BWP, as you've shared. How many organizations have joined and how were they selected?
Yeah, so the coalition, again, starting from the process that began back in the fall of 2019, has almost 30 organizations. And so those organizations that have endorsed the platforms, have participated in various processes over the last few years. And again, we encourage organizations that haven't had a chance to take a look at that platform. If you're aligned with our values and principles and those priorities, we're looking to really grow that Bronx-wide coalition. And then we have a core group, which is our leadership team. And that's currently 12 organizations representing community-based organizations, faith institutions, and you also have labor at the table. And the leadership team is really responsible for making decisions and thinking about the strategy of this work overall. And so it felt really important that the core really reflects organizations that are member-led, that are grassroots, and that really do a lot of work engaging residents on the ground. And so those folks are at the table, both representing staff and then delegates like Roberta, who are, leaders in their community affiliated with those organizations. And again, as Roberta said, right, we know the Bronx is a huge place, right? We have 1.5 million people. We're a very diverse place. And so our goal with the coalition is to really ensure that the diversity of the Bronx is represented. And also the diversity of experience and expertise, right? We have these different systems. We know all of these systems are interconnected. And so it's really valuable to have a space where folks can really bring the work that they've been doing around housing or energy or food into the conversation to make sure that that's reflected, but also to support us in really making those connections across those areas and really thinking about the systemic solutions that we need that are going to be cross-cutting if they're going to be impactful.
Right. If someone is tuning in and wondering about future events, or is there anything else coming up for people to participate in?
Yeah, so we have a lot coming up in the next few months. The kind of central place where you can find information is our Linktree. So Linktree /BX Power. And so there you can just access links to upcoming events, make sure to register. And then if you want to fill out a form to get involved, that's also really helpful information for us. And just on that note, we've been connecting individual community members based on their zip code or their areas of interest to organizations that are part of the leadership team. So we want to make sure that community members are connected to organizing and kind of this broader movement through our organizations. The other easy way is social media. So at Bronx Future or at Northwest Bronx are two easy starting points. We're constantly posting flyers, uplifting the work of the other organizations. We tag folks, so that can also be an easy way to connect to the other organizations in our network. And then specifically, we still have a few more candidate forums coming up. So March 31st will be the next one at 6:30 p.m. and that's for Council District 14. We're having forums in April for District 16 and 17. We'll have one in May for Council District 18, and then in May and June, we'll also be hosting, the Bronx Borough President candidates and the mayoral candidates. So, on that piece, there's ongoing work. Our partners are also hosting civic engagement activities, including workshops on ranked choice voting. So that's the new voting system. And again, you can, find all that information on the link tree. And then we're also kind of about to launch our next phase of the work. So creating a platform and identifying policy priorities was a really important first step, but we know we need to really create a comprehensive plan for how we build a different future for the Bronx and transform our economy. So on April 9th at 5:30, we will be launching our Bronx-wide planning process. So that will be an opportunity to hear and connect to the next phase of our work. And then lastly, just to connect, Northwest Bronx is hosting a health justice town hall on April 11th at 5 p.m. And that is with other organizations, again, connecting to the health justice movement and really thinking about what it will take to ensure that, all of us have access to quality healthcare in our communities.
Wow, plenty of important work going on over at the Bronx-wide platform. That is an understatement, so thank you so much for sharing all the events, and we'll be sure to share those flyers on the screen as well. Thank you, Katherine and Roberta, for joining us today and sharing more about the Bronx-wide platform.
Yeah, thanks for having us, Sonyi. Thanks.
We'll be right back here on Open BXRx.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Geraldine. Welcome back. March is National Colorectal Cancer Awareness Month. So today we will be discussing the importance of screening for this and other cancers that affect people around the country and here in the Bronx. Welcome to the Whole Health Report, sponsored by Empire Blue Cross Blue Shield. I'm excited to welcome back Dr. Craig Hersh, the Chief Medical Officer at Empire, as well as his special guest, Dr. Geraldine McGinty, the Chief Strategy and Contracting Officer and an Associate Professor of Clinical Radiology and Population Science at Weill Cornell Medicine. Welcome, Dr. Hersh and Dr. McGinty. Thank you so much for joining us. Nice to have you.
Hi, Sonyi. Thanks for having us.
Always great having you here, Dr. Hersh. So before we start, we're discussing colorectal cancer, Doctor. Can you share why it's important to raise awareness this month and, every month, really?
Yeah, absolutely. Colon cancer screening is vitally important. And I say that as a physician who's ordered a lot of screening tests, but also as someone who's personally experienced screening tests and sees that it can change a life, right? That has impacted my family and has permanently changed the destiny for the better. So that's sort of the firsthand experience. What I would tell you is that's the experience that we want other people to have too. That's the mission of Empire, to materially and measurably improve the lives of all, the health of all New Yorkers. So when it comes to cancer screening, it's not just colorectal cancer we look at. That's what we're going to focus on today. But there's also other areas like breast cancer, lung cancer, colorectal cancer we mentioned, and cervical cancer. And I'm happy that Dr. McGinty is able to join us today and can give us sort of an expert's view of screening for cancers.
Absolutely, yes. I've heard early detection through screening can save lives, and I'm looking forward to hearing more from Dr. McGinty. First, Doctor, can you tell us a little bit about what you do at Weill Cornell Medicine?
Thanks so much, Sonyi. Yes, so I'm a radiologist, and I specialize in breast cancer screening and detection. But radiologists also are involved in both lung cancer screening and lung cancer detection, as well as colon cancer screening and detection. So right now I work at Weill Cornell in Manhattan, but actually I started my career at Montefiore and I worked there for many years. It's a place that's very dear to my heart.
Wonderful. Thank you for sharing, Doctor. And can we start by explaining what exactly colorectal cancer actually is? It's not as obvious as breast cancer or lung cancer, is it?
No, it's not. And what we're always trying to do with screening is we're trying to pick up these things before you notice them yourself, before they cause symptoms or cause anything to feel wrong to the patient. We're trying to find disease really early so it's more easily treated or cured. And colon cancer starts in the colon or large intestine. And polyps can develop on the lining of the colon or the large intestine. And some of those polyps eventually can go on to become cancerous. So it's important to find them when they're early.
Doctor, what exactly causes those polyps?
It's a great question and probably a little bit out of my clinical expertise, but there are many polyps that aren't cancer. As I say, it's just a question of finding them and treating the ones that look more suspicious.
Got it. And, you know, what I've heard also is that African Americans and Hispanics are especially affected by colorectal cancer. Do we know why this is?
Yeah. So listen, there are various risk factors for colon cancer, right? They include genetics, age, obesity, smoking, diabetes, and some other disorders like Crohn's disease and ulcerative colitis, which already affect the colon. And like you said, Sonyi, there are inequities. You know, I would say that African Americans and Latinx probably has about a 20% higher prevalence of getting these conditions, and actually a 40% higher chance of dying from these conditions. As to why, it's not completely clear. Part of that is that the risk factor profile is just greater in those populations historically.
Wow, very shocking, you know, things that are going on in our community, especially in African American and Hispanic communities here in the Bronx. Doctors, who should get screened for colon cancer? Let's say someone is listening right now and they're not sure if they qualify or should be screened. Who should?
So the American Cancer Society recommends that you start screening at age 45 or thereabouts. Now that's really for people with average risk. As we know, we tragically lost the great actor Chadwick Boseman last summer, and he was obviously very young when he died. So especially if you have a family history of colon cancer or any of the underlying conditions like ulcerative colitis that might make you at higher risk, it's important to talk to your doctor about whether you need to start getting screened earlier or get screened more often. Good news is, though, that, you know, when we find colon cancer early, it's very treatable. So really, you know, keep in touch with your doctor and certainly look out for any of the symptoms.
Yes, doctor, I actually want to emphasize on that. As you said, Chadwick Boseman was very young. He passed away at 43 years old from colorectal cancer. We did mention that colon screening should be done at 45, but it is important to get it done sooner than that. Is that what you're saying, doctor?
Well, if you are not at average risk, if you know that you're at higher risk, or if you notice any of the symptoms, so any rectal bleeding, any change in your stools or your bowel movements, and anything, constipation or diarrhea that lasts longer than you might think of just a viral infection would last. So again, check with your doctor if you're at all concerned.
This is why it's really important to have these awareness events as well, and this segment with Empire Blue Cross Blue Shield. So thank you for that. I read an article recently where a local man actually got tested and found out he had colorectal cancer after he found out about Chadwick Boseman's case. So just hearing about these cases also inspires folks to get the screening done on time. So thank you both for, raising awareness and being here with us this month. Another thing I wanted to discuss is here in New York, recent immigrants and low-income groups and those living in the boroughs outside of Manhattan were significantly less likely to get screened for colorectal cancer. Why do we think that is?
Well, some of the symptoms and can be a little embarrassing. So, there's that for sure. But I think that one of the things that's been really important in the last year, of course, is the impact of the pandemic. And not surprisingly, I think people are maybe a little nervous about coming to see their doctor on site or coming for a test. But what people should know is that we have worked extremely hard to make sure that it's absolutely safe to come to the clinic, to the medical center. The last thing we want is anybody missing the care that they need to get because of worries about COVID. We've made it safe. So please do not neglect that.
I've also read that there are home tests for colon cancer. Are these also safe and effective?
Sure, there are what are called fecal occult blood. So you collect your own sample of stool and send it off to the lab. Obviously, though, if that comes back with any abnormality, you'll still need to get a colonoscopy.
Got it. And doctor, just an emphasis on what the impact COVID has made on screenings. How have they gone down or increased or anything like that?
Sure. Well, there's definitely been a significant increase because, of course, we had several months last year where we really couldn't have people coming on site for any kind of elective or routine procedures. But, just in my own specialty of breast cancer screening, there was an 87% drop in mammography and a 90% drop in colonoscopy. So obviously, we're really working hard now to catch up.
Definitely preventative care is the most important thing here. And it's just a reminder, as Dr. McGinty said, it is safe to get tested and it is safe to visit your doctor at this time. So we'll get that information over to our viewers at the end. But other than screening, is there anything that we can do to fight cancer?
Well, I did want to talk about one other important screening program, which is lung cancer screening. 1 in 7 adults in the Bronx is a smoker. So we know that screening with low dose CT scans or CAT scans of the chest can really find lung cancer earlier. So that's another one to talk to your doctor about. But, I think, and Craig can certainly weigh in, but, having a healthy, balanced diet, getting regular exercise, maintaining a normal weight, obviously quitting smoking. And there are plenty of programs available to help you with that. Minimizing alcohol consumptions, and of course, maintaining a regular relationship with your doctor.
Absolutely. Yes, Dr. Hersh, did you want to add on to that?
Listen, it's never too soon to put in place those lifestyle changes, but obviously the sooner you do it, the better, because cancer doesn't grow overnight.
Yes, thank you so much, doctors. And finally, where can people go to get more information or get help at this time?
So listen, for screening, you're really best off starting with your own doctors, your own local hospitals. A lot of hospitals have screening programs specifically set up for this. Beyond that, if you want to get additional information, there's 3 good sources I'd recommend. One is empireblue.com. There's very good information on there about which tests and when to get them. There's also cancer.org, gives you a lot of background information, and 311, the New York City helpline. Those are what I'd recommend.
Thank you, Dr. McGinty and Dr. Hersh, for joining us today. That was some great information. Dr. Hersh, we look forward to having you back soon with the whole health report from Empire Blue Cross Blue Shield.
My pleasure. Thank you.
We're taking a quick break. We'll be right back here on Open BXRx.
most at risk for coronavirus. People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
There's a special election on Tuesday, March 23rd, and if you live in any of these neighborhoods, you'll want to pay attention. Your councilman, Andrew Cohen, is now a judge, and there are 5 candidates looking to replace him. Whoever wins on March 23rd will join New York City's primary lawmaking body, making decisions that affect you, your family, your home, and even your workplace. Starting in 2021, New York City will use ranked choice voting in primary and special elections for local offices. Ranked choice voting simply means that voters can rank up to 5 candidates in order of preference, instead of casting a vote for just one. You can still vote for just one candidate if you prefer. You can learn everything there is to know about the District 11 City Council race and the candidates by visiting ballotpedia.org and riverdalepress.com. Stay informed, and most importantly, make sure you mail your absentee ballot the day before Election Day on March 23rd, or safely head out to the polls to have your vote count and your voice heard. Welcome back. In an effort to support local small businesses struggling with tech needs, Scholas recently launched a new virtual initiative called the Tech Help Desk. Joining us now to share more about this initiative and more are Abe Mendez, Managing Director of Scholas, and Instructor, Brittany Grant. Welcome. Thank you both for joining us today.
Thank you so much for having us.
Of course. So Brittany's new to the show, but Abe, you're no stranger. You've been here before. But for those of our viewers who aren't familiar, can you please share what Scholas does?
Absolutely. So Scholas was proudly founded 25 years ago in the South Bronx. Our mission is to advance economic equity through rigorous training for tech careers and by connecting the skilled talent graduating from our programs to leading businesses. We do this by offering tuition-free 12 to 15-week training programs that prepare individuals to become help desk support technicians, cybersecurity analysts, web developers, and cloud engineers. And this year, Scholas in New York will train over 600 adults in over 30 classes through these in the courses I just described.
Wow, thank you so much, Abe. And, as we know, through COVID-19, the latest unemployment rate here in the Bronx in particular was reportedly 15.1%. That is nearly double the rate of other counties in New York State. How is Scholas helping address high unemployment rate here in the Bronx?
Absolutely. So at Scholas, we're training for skill sets in technology that are incredibly relevant to employers of all shapes and sizes. So we really work closely with employers to ensure that our training programs are relevant and meet their needs today. And ultimately, our program is designed to help our participants and learners land that job in technology. Each class is paired with a technical instructor, but they also are paired with a professional development coach, which works with our learners to really hone in on their soft skills. So we graduate really well-rounded candidates and share openings from our employer partners with them directly. On average, 80% of those who complete the course will get a job and they'll start earning an average starting wage of $21 an hour.
Wow. Aside from launching incredible careers in the tech field, now Scholas is helping our local small businesses. Can you share your new Tech Help Desk and how local small businesses are being supported through this new initiative?
Yeah, absolutely. So last year, Scholas, like many organizations, made the transition to operate our programs virtually, and ultimately we were successful. But of course, it wasn't easy. And if you think about communities like the Bronx, which were heavily impacted, not just from a public health and economic standpoint, but from a technological standpoint, we really saw an opportunity for us to provide value to the local community. And thanks to the support of the Bronx Community Foundation, we were able to launch a tech support help desk that's a free service that's going to be run by alumni of our programs. And so my colleague, Brittany Grant, who is an amazing technical instructor. She's been working with Scholas for 3 years, also a graduate of our programs. Really worked closely with me and others to build out this help desk, and she'll share all the great details with everyone now.
Absolutely, Brittany. So it sounds like you're a triple threat. You are a learner, a teacher, a student. You've taught, and you've learned at Scholas. So that's amazing. You know, full circle moment for you. What types of services and issues are being provided by Scholas alumni through the Tech Help Desk? As we heard from Abe, they're free to local businesses.
They sure are. Here at Scholas, we're proud to be able to offer free level 1 tech support. This can include a wide variety of services. For instance, we can help you set up your printers and your multifunction devices, allow all your computers to be able to print to them. We can provide compatibility support for users that are either trying to update or maybe upgrade their current system, whether that be hardware or software. And we can also assist with malware and virus remediation, which is now becoming a popular thing, all for free, which is a great thing.
Wow. And, you know, I know some local businesses may be in tune to the show right now. How can they inquire about these services? And, you know, who qualifies for it? Is it any local small business?
Anybody, any individuals, local small businesses, nonprofits, anyone. We've actually been able to help a few people already. We had an elderly gentleman get his computer backed up and updated to the latest version. We've helped our learners prepare for their oncoming courses by making sure their systems are up to date and optimized. And it's really easy to get in touch with us. You can either go to our website, www.perscolas.org/NYHelpDesk, or you can send us an email to nyhelpdesk@perscolas.org. Once you do that, let us know the issue that you're having. Once that's done, you can expect someone from our help desk to reach out to you within like 24 to 48 hours and schedule a service appointment that adds at their convenience.
That sounds amazing. Thank you for sharing, Brittany. And, you know, I wanted to add a little extra in there for you. I want to hear about your story with Scholas. How has it transformed your life, you know, learning and also educating through the programs that are offered in this amazing initiative?
It's full circle, like you mentioned. Honestly, I was the Jane of all trades before I went to Scholas, and I never felt like I got paid my worth because I did everything. And then coming to Scholas, it really honed down on my passion for tech. And I realized then that I could help my classmates learn. And that kind of sparked that passion that maybe I would like to teach. And since then, it's been a joyous, you know, voyage with all the learners that I've had, and seeing them successful and making good money. It makes me happy.
And it's, you know, good to point out that you're also a woman in tech. So do we see a lot of women in tech, and how, you know, what does that mean for you?
It's increased. It's something that I'm very passionate about. I love to encourage all my learners, but I have a special, like, you can do it for my women in tech. The classes are increasing. Believe it or not, the women are no longer afraid of tech. They're going out there, and a lot of our women learners are taking it over, and they're actually getting better offers and more confident. So I love to see the progression of more and more females coming into our class. And I can't wait till we have those all-female classes as well.
Yes, listen, it's Women History Month, so what better time than now to sign up for some Scholas programs and services online, right?
Exactly.
Abe, I want to hear from you as well, Abe, just about, you know, being inclusive in your programs for.
Absolutely. First, I'll say, you know, Brittany is an amazing talent. We're lucky to have her support. She's actually expanding her skill set. She's able to teach our IT support class, but also soon will be teaching cybersecurity as well at Scholas. So I just want to give her the shout out that she deserves. But you're exactly right. You know, the reason why we're looking to recruit over 600 candidates this year is that we know that, you know, especially vulnerable communities, folks can really benefit from an opportunity that Scholas can provide. And we want to continue to expand and grow to recruit, you know, women in technology, Black and Latinx folks to become technologists, young adults of all ages. And so, you know, you can expect that over the years to come, we're going to just be growing and expanding the number of seats, since we know that a program like Scholas can really set someone up on that pathway to not just achieve a living wage, but really achieve a thriving wage over the long term.
Absolutely. And before we go, what are some of those courses that folks can take, Abe? Just give us a little rundown of what programs and courses folks can take.
Absolutely. So we offer 4 disciplines here in New York. Network support or IT support that prepares folks to become entry-level help desk support technicians. 12-week program. Also leads to the CompTIA A+ credential, as well as a Google IT support certificate. That's really fantastic. We offer cybersecurity, which is 15 weeks. It leads to the CompTIA CISA+, and it prepares folks to become those entry-level cyber analysts, software engineering, preparing folks to become web developers and coders. That's also 15 weeks. And our newest course, which is called AWS Restart, is essentially a cloud fundamentals course, leveraging tools from AWS, and will prepare folks to become, cloud engineers in 15 weeks as well.
Wow, so many broad interests. Whatever you're interested in, you can learn at Scholas. And hold on, Abe, are there any strings attached to any of these courses?
No strings attached, tuition free. Our programs are tuition free to ensure that as many folks can benefit from our services as possible.
Amazing.
We only ask our learners to pay it forward. That's all we ask.
Got it. And Brittany, how important was that for you when you were learning, the fact that it's all no strings attached?
I didn't believe it at first. And a lot of our learners don't really believe it at first because you don't hear it that often that it's free. But it saved me because those exams are costly. And having a support system that said, don't worry, we have you, really helped me make sure I could just focus on my learning and get the, certifications I need to pass through the course.
Amazing. Listen, if I wasn't a reporter, I'd be at Scholas learning computer technology, but it's never too late. I can still learn it, right?
You're welcome anytime. Anytime.
Thank you so much. Before we go, Abe, how about Bronxites who are interested in learning more about the programs? How can they get in touch and find out about the courses being offered at this time?
Absolutely. So we are constantly recruiting for new candidates. So I encourage anyone who's interested to go to perscholas.org, read up on the courses, look at our deadlines for applications, and send us any questions as well. So I encourage folks to check out the website. We also have an email address, info@perscholas.org, for folks who are curious and want to learn more about our classes as well.
Got it. And Brittany, before we go, I also wanted you to just, motivate our Bronxites to go ahead and take a chance.
It's possible. Anything, as long as you put your heart into it, it's possible. It's a 15-week intensive course, but you have support along the way, whether it's your instructor, your career development coach, or even your learner support team that we have. We welcome everyone. Come all. And let's join the Scholas alumni.
Thank you. Thank you, Abe Mendez and Brittany Grant, for joining us today on behalf of Scholas.
Thank you.
Thank you.
Again, you can visit perscholas.org to find out more information about their programs and services. And if you're a local business, you can also find out about their New York help desk through their website. We're taking a quick break. We'll be right back with Open BXRx.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. BronxArtSpace recently presented an opening reception to a new exhibition called Giving Light, an art antidote to gun violence. The show features 11 artists and has been curated through the lens of a mother, community organizer, and Bronx resident. Joining us now to share more is community liaison and curator Beverly Emers, accompanied by Leslie Lee, the founder of Soapbox Project, a project meant to raise awareness of the U.S. gunfire epidemic. Welcome. Thank you both for joining us today.
Thank you.
Yeah, great to be here.
Great to see you. So Beverly, please tell us about your curatorial debut exhibition, Giving Light, an Art Antidote to Gun Violence.
Yeah, so just to give a little background, the epidemic of gun violence as a mother, it has sort of instilled fear in me, and it's been on my mind for quite some time. And also being a victim of gun violence through a domestic violence relationship, I just felt compelled to do something, and just in response to what I was feeling and just sorting through my own trauma and questions that I had. And, just having the opportunity, being in an art space and being able to find artists that communicate what I was feeling has been an awesome experience. And it's really, I really just want to focus mostly on trauma. How do we heal from it? Because, unaddressed, it kind of perpetuates and it shows up in different areas. And just living in the Bronx, I know we just need a lot of healing because of things that are happening in our daily lives here.
Thank you, Beverly, for sharing your own testimony and, reasoning behind sharing this incredible exhibition with Bronxites. We were able to visit on behalf of BronxNet to cover the show, and it was incredibly impactful and touching and everything above. So, thank you for curating such an incredible experience. I know some people may be wondering, what is some of the art that's featured? Can you share a preview of maybe 1 to 2 pieces in the show and tell us a little bit about them?
Sure. Well, one of the pieces that stood out that I related to the most was a piece called Trigger Words by an artist named Feliz. And I just felt like we were identifying because she used her son as a muse in the piece. And it was sort of like she was mirroring what I was feeling as a parent, her and her son, just the fear. And also, becoming, moving from victim to perpetrator. And this also sheds light on how unhealed trauma can kind of perpetuate a cycle. Like if you're not dealing with your own trauma, then maybe you will then victimize someone else. So I felt very connected to that piece. The other piece was More Than Just a Hashtag by Tasha Duje. And in her piece, she reflects on how many lives have been lost, particularly brown and Black bodies have been lost to gun violence, and how it's just reduced to a hashtag and people are not honoring their lives and lifting them up. It was also a learning experience for me because part of the piece, it reflected on the art of kintsugi, which is a Japanese art form of mending broken pottery together. And I kind of related that to my own life, right? And just the brokenness, but just putting myself together, and the cracks are dusted by gold, and the things that may have seemed as imperfections become the thing that defines you, the things that give you beauty. So More Than Just a Hashtag, it made me do some research, and I'm embracing it. And I'm also considering, hey, we need to do a kintsugi class at BronxArtSpace. Yeah.
Right. Now that would be amazing. And, I didn't know about that art, the kintsugi practice in the past. So I'm glad that this is coming to the Bronx and we're learning about these different practices through art by Bronx local artists as well. I think the two artists you mentioned are actually from the Bronx as well, right, Beverly?
Yes, they are. And I just wanted to add that Morrissey grew up around the corner from Art Space. And her being there, a lot of individuals that may have not entered the space came to support her. So I'm really glad about that it just gave us a further reach to the local community.
Yeah, I just want to emphasize that BronxArtSpace is an inclusive art environment for the entire community to come and visit and enjoy art and, take it all in. So I love it personally. So Beverly, something you mentioned is that Giving Light highlights trauma, but it also highlights healing. Can you tell us why it was important to focus on the healing aspect from gun violence?
Well, I lead through my own experiences, and healing's been important for me. And so I particularly, so the thought is my processes, because I had a lot of trauma, what I consider trauma in my childhood, because I was treated aggressively by my mother, but it was sort of passed on to her, and it's being passed on. And so I know that I had sort of embraced that's the thing that was passed on to me, and being very mindful how I treat my son, like, as far as putting my hands on him or how I talk to him. This is very real, and I see it like all around me, and I wanted to break the cycle. But then also I believe that in the development of children, when we're getting treated aggressively, that kind of sets, the pace for who we are. And I just think that is really important to look at how we heal and how we perpetuate it in the community. I know that I'm not a social worker or a scientist, but I know that the body keeps the score, right? So when you go through trauma, it has to go somewhere. So I offered up the art exhibit. We are doing some healing circles and some other things that will carry on. So it's not about the exhibits, like how could we be honest with each other and how could we heal together?
Right, having those conversations, and we're definitely going to share some of those events happening in the programming at the space a little later on. But speaking of healing, we have Leslie Lee here from Soulbox Project, and she has some beautiful boxes behind her. Leslie, can you tell us about the Soulbox Project?
Yes, and I'm so pleased that Beverly found us and wants to make the Soulbox Project part of the healing in her exhibit, because this is exactly what we wanted to have happen. The Soulbox Project is a community act of artivism. It's national. It's something that I started after the Las Vegas shooting in 2017, when I was just shocked into looking at the statistics, and the numbers of deaths and injuries by gunfire was just so huge that I just thought, these are not comprehensible. Our brains aren't wired to understand numbers like that. I mean, we can say that over 70,000 people are killed or injured by gunfire every year, but unless somehow we can see it and feel it, you might not be moved to do anything about it. And so we've asked people all over the country to make these small origami boxes, and they're coming together into exhibits. It's a lot parallel to the AIDS quilt in that regard. And so what we're doing with these exhibits is showing people the numbers, and the boxes themselves often have names or messages on them, or sometimes they're just plain boxes, which are often holding space for suicide victims whose names we don't know, which are over half of gun deaths in the US. So being part of having this come to the exhibit in the Bronx, where people can come and make folding these boxes part of their healing, is extremely powerful. I mean, we have lots of testimonials from people who are saying, I didn't realize how much it would mean to me to fold one of these origami boxes and then know that my small piece of art is going to be part of this huge revealing of the numbers.
Oh, beautiful project. And thank you for sharing, Leslie. You have a big event coming soon to Washington, D.C., actually. Can you please tell us about this event and how Bronxites can participate to have their soul boxes featured there?
Yeah, we've been planning to exhibit these boxes on the mall for some time. We were going to do it last October. COVID stopped that. We were going to do it in April. COVID's still stopping that. This is going to be in October of 21. And so we will be on the exhibit, on the mall, exhibiting these panels, and also thousands and thousands and thousands more boxes that are contained in large bags that are going to be carried. They're clear bags that will be carried by people in procession. So we're guessing about 400 people, maybe more, to carry these things in. And we have to realize that what we're going to see when it's all said and done is only going to represent 2019, 20, and 21 to that point. You know, I mean, it's just, the numbers, when you see them like that stacked up, is overwhelming. So we would like people to participate by coming to DC and carrying, you know, being in the procession, helping carry these boxes in. But they're also welcome to make boxes, send them into the project. We're out here in Portland, Oregon, and we will try to get them onto these panels before the exhibit. They'll need to come in before August in order for us to get them into the exhibit. But we'll try to do that if we can.
Absolutely. And Beverly, let's get our Bronxites on board with this amazing project. How can people make a soul box over at BronxArtSpace?
Okay, so we have a station. However, the Soulbox Project hosts virtual workshops every other week. I encourage everyone to go to their website and look. If we need to just be a drop-off location until August, the exhibit is open until April. But I'm making the commitment to be a collection site. This is a partnership. So you could reach out to BronxArtSpace, go to Soulbox Project, meet the staff and all the individuals making these soul boxes every other week. Yeah, and you know, hopefully, you know, once the COVID it eases, other art organizations could join in. We have a lot of cultural institutions in the Bronx. Just reach out. Just reach out. We got you. BronxArtSpace, we got you.
Absolutely. And finally, just an invitation to the Given Light and Art Antidote to Gun Violence exhibition, and you know, until when it'll be and what times you'll be open.
Yeah, so we're open Thursday and Friday from 12 to 5, Saturday from 12 to 6. The exhibit ends April 8th. Please check our website. We're gonna have a day of healing where you come get some breath work done, get an aura cleansing. We have the Mott Haven Film Festival. We have a 3-day dance series. We have things for you to do. We have things for you to do. So please check out the website. And you can also check for us on Instagram.
At BronxArtSpace. Thank you so much, Beverly and Leslie, for joining us today.
Thanks for having us.
Thank you.
Thank you. Beverly Emers is the curator and community liaison at BronxArtSpace, and Leslie Lee is the founder of Soulbox Project. Well, that's all for our show today. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Take care, everyone.